Hi guys, this is Dr. Afrah, cosmetic physician and general practitioner. Today I'm doing a live chat about injectable treatments. I just wanted to talk about the frequently asked questions and queries that people usually have if they don't have much experience with injectable treatments. So I've written down a list of questions of what I could come up with and what I could think of, but if you've got any specific questions that if I don't mention it, please ask me. The only thing I would ask is to wait maybe towards the end of the chat to ask your questions, because I may address them anyway. I do have a long list with me. So let's get started. I'm going to be focusing on anti-wrinkle injections or muscle relaxants as well as dermal fillers today. I won't be talking, there's a lot of other injectable treatments that we do, but I won't be talking about the rest of them. The other thing that I'll make sure that I mention at the start is I can't mention brand names and I can't mention chemical names. So I've got to be very generic about what I'm saying, but I think most of it will make sense to you anyway. And that's because of the TGA guidelines of advertising in Australia. So the first question, what are anti-wrinkle injections? Really, I think anti-wrinkle injections should be called muscle relaxant injections because that's what they are. They relax muscles. And because of this activity, they can actually be used in lots of different medical as well as cosmetic treatments. Speaking from a strictly cosmetic perspective, anti-wrinkle or muscle relaxant injections are used usually in the facial muscles to reduce movement of the muscles, which then in turn reduces formation of lines as well. For instance, one of the most commonly treated areas in the face is the frown area, and most people will frown by drawing their eyebrows closer to each other. This is the mechanism of frowning, and you'll end up with what's called 11s or lines just vertical in the frown area, and this is what people common with. Probably one of the most common complaints is the 11s, and we treat that by relaxing the muscle. The way it works is once the muscle has been blocked from movement and it relaxes, the analogy I give my patients is think about your skin like a piece of paper. If I keep folding the paper, I will make deeper and deeper lines in the paper. If I relax a paper and never move it again, and keeping in mind that your skin is a dynamic paper, it's not static, it's continuously turning over cells and renewing itself, that skin or that paper will actually become a lot smoother in time. And that's what we're trying to do with muscle relaxant injections. We're trying to not just stop the muscle activity, but actually give the skin enough time to make some more of itself and become smoother. So I've actually seen some pretty deep set lines get smoother and softer with time. You just have to do the treatments quite regularly to do this. From a chemistry point of view, how the chemical actually works, it is a toxin per se. It's derived from a bacteria that has the capacity to relax or really freeze muscles and paralyze them, and from that perspective it can actually kill people in lethal doses. But what we do is take really, really small, tiny, minute doses that tend to stay quite localized in the area and treat a given set of muscles with it, with actions that we know are quite predictable or results that are quite predictable, and just treat that area. The product in itself goes to, let's say your muscles have gateways in them, and there are certain things that need to cross the gateway to activate the muscle to move it. What this product is doing is shutting those gateways down. That's basically what it's doing. So the muscle is not given those signals to move, and it stops moving. Over time, the other thing that we find if you're treating the muscle is the muscle loses not just its strength and the ability to contract, but it actually also loses its bulk. And as we know, in some areas we love doing that. We love reducing bulk. For instance, the masseters, we love reducing the bulk because it narrows the face. So I might talk more about some of these things as we go on, but let's go on to the next question. What are the risks and benefits? There are risks to everything. Every single thing that you do to your face, single thing you put on your face, there are risks to everything, and there are risks to these products as well. And I think that most of the risks are actually in who is injecting you. That's, I think, the biggest risk. Do they know what doses to use? Do they understand the muscle? Do they understand the anatomy? Do they understand the potential complications? Are they aware of what can happen in certain areas? So I think the more of the risks are dependent on your injector. And the risks are things like being injected in the wrong spot above your eyebrows and having your eyebrows drop, for instance. That's one of the risks. Some of the other risks are, again, dose related, muscle related, being injected around your mouth, and instead of just softening the corners of your mouth, ending up with a dropped smile. Being injected in your neck bands and ending up with problems with swallowing. Being injected around your eyes and ending up with double vision. Now, out of all of these sort of potential side effects, the one that I've seen probably most commonly is that heavy brow or that slightly drop brow. A true drop in the brow is quite rare. I've never personally seen it. What I have seen is people end up with a heavier brow, or they just feel like they can't elevate their brow. And that can happen if the forehead muscles are quite frozen or too big a dose has been put across the forehead. And that can reduce the ability to elevate the brows, thus giving a feeling of heaviness. So these are the kind of risks associated with muscle relaxants. From a systemic point of view, there's been a lot of studies done on these products, obviously, since they've been around, which is since the 1970s. There's not a lot of systemic effect that we've seen, and I'll come back and talk about that a little bit more further down in the questions. But I've done a lot of research into this. I've looked at a lot of studies, and I can't really find, aside from some of the localized risks, any long-term effects or any long-term systemic risks with using these products. Benefits, there are many benefits. Of course, anti-aging is just one of them. That's just one of the indications for using muscle relaxing injections. There's so many other indications for it. We can also reduce sweating, and in areas where I've injected on the face for people as well, I've noticed reduced pores and reduced sebum production, and that makes sense because muscle relaxing injections, the product they contain, can actually reduce sweating and reduce sebaceous gland activity. So we know that the skin overall improves and looks quite nice. But we also use this product for hyperhidrosis, which is excessive sweating. And I personally injected for patients in the armpit area, the axillary, the palms, and the soles of the feet. I've actually even done a groin. So really it can be put anywhere as long as you know what you're doing and you're being quite safe with it. Are they dangerous? So I think I've already touched on this with the risks. Everything is dangerous if it's in excess or if it's done inappropriately. And muscle relaxant injections are dangerous, and I've already mentioned some of the risks: dropped muscles, double vision, problems with swallowing, problems with smiling. Those sort of risks are probably the more prominent risks, and I don't think I've heard of or seen much else outside of this. There are studies that report much rarer side effects, but I've never personally seen them. So I think what's rare is rare, and some of these side effects were not actually reported in human beings. Some of these tests were done on rats. The next question I had was, will I need them forever? This is probably one of the most commonly asked questions from patients. Patients are worried if they step into the world of cosmetic injectables, they will be signing up for a lifetime of this. And the way I explain it to them is, you will never stop looking after your skin. You will never stop looking after your health, and you will never stop looking after yourself. So exercise is something you do every day or regularly. Eating well is something you do regularly. Looking after your skin is something you do regularly. Wearing sunscreen is something you do regularly. So injectable treatments are the same. They're not a cure. It's not a surgery. You're still aging. You're still getting older. You're still forming new lines. You're still forming new wrinkles. So the treatments have to continue. In order to get a certain result. If you didn't really like the result, or if you weren't happy with it, you don't have to continue it. But if you wanted a certain look, a certain refreshed anti-aging look, then you do have to continue them. If I stop using them, will I age more quickly? Now, this is another common one that people really worry about. They think, if I've had it done once, I feel that I'll just keep needing to do them. If I don't do them, I'll almost age faster than I would have otherwise. This is not true. If anything, I think that it slows down the aging process. And even if you had a few treatments and decided never to do it again, you will still benefit from those few treatments. Of course, 1 or 2 treatments doesn't make much of a difference in the long term, but anything more than that does make a bit of a difference. Why can't I have them when I'm pregnant and breastfeeding? Now, this is where I said I've looked at a lot of studies, and I was going to come back to not really finding anything too dangerous or too risky about using muscle relaxant injections. So there are not a lot of studies done on pregnant or breastfeeding women. As you can imagine, we don't like to do studies on women who are about to give birth or women who are looking after a baby, probably from the perspective of not putting a baby or the fetus at any harm. But even in the studies that were done for women who have inadvertently, without knowing they were pregnant, had treatments, or women who've had to have the treatments anyway for medical purposes, no real problems were noted in the fetus or the babies or the patients themselves. So I think overall they're quite safe products. What are their systemic effects? Again, going back to the question of looking at the studies on systemic side effects, really none, almost none, from what I've looked at anyway. And of course, if there's more stuff coming up, I would be interested to see it. But if in the last 30, 40 or 50 years they haven't found anything, I think, again, you could safely say these are pretty safe products. Can they be used for medical reasons? Absolutely. There's a whole list of reasons we use muscle relaxant injections that are medical, and I've talked about some of them briefly. The ones that I personally treat people for are things like hyperhidrosis, which is excessive sweating, migraines or headaches, and bruxism, which is teeth clenching. Will I look frozen and fake? I think this is probably one of the biggest fears amongst people who haven't had anti-wrinkle treatments or dermal fillers. Will I look fake? And the answer to that question is you can. It depends on your injector, it depends on the end result, and it depends on what you're after as well. I have patients ranging from people who have to activate their facial muscles for their professional purposes, or patients who don't like to have the area frozen and would like a little bit of movement, to people who want to be completely frozen. So I have a whole range of people that want a different looking result. And to all of them, I say all of it is achievable. You can get softness without compromise in movement. You can get softening of movement to target the lines that are starting to form, the static lines, especially, not just the dynamic, even more. And then you can definitely have a frozen look as well if that's what you want. Now, a frozen look doesn't have to look fake. So these are two different things. You can be frozen but not fake. I personally find if people are looking fake, it's because of dermal fillers, and I'll talk about them a little bit more. But I think most of the time it's over volumization with the dermal fillers rather than the muscle relaxants that makes people look a bit fake. Oh, yes. Moving on to the next question, but it's unnatural. Most things that we use in our life are unnatural. So there are lots of natural therapies as well. They can help skin quality, and I'm all for them. There's so many things that we use that come from natural resources, and they're fantastic for your skin. But when it comes to, sorry, I just knocked my light there. When it comes to movement in your muscles and static lines, nothing that you apply to your face topically works. Nothing can stop that from happening. The only thing that can stop that from happening is the product injected into your muscle that relaxes or affects the channels between those muscles and stops them from moving. That's really the only way to stop line formation. There really is no other way. From a natural or unnatural perspective, it does come from a bacteria, so you could argue it's actually a natural product. But anyway. What are dermal fillers? So I'm going to move on to dermal fillers now. And in the end, if you've got any further questions about muscle relaxant injections, if there's anything I haven't addressed, please ask me. Dermal fillers, there's a whole list of different kinds of dermal fillers. So I'm not going to go into all of them. The two main classes are permanent and temporary. And I think very few people use the permanent fillers anymore. Most people now use the temporary dermal fillers. And again, I can't talk to you about the specific ones, but the ones I use are the dissolvable ones. So if that makes it a little bit easier to understand which ones I'm talking about, it's the ones that can be dissolved. The reason I like dissolvable temporary dermal fillers is because of the fact that it's like having a pencil or a pen, but having an eraser attached to it. In case something goes wrong or something doesn't look right, you can dissolve it. And in a lot of cases, this comes in extremely handy. As you can imagine, there are problems attached to everything we do, and this is where that dissolving can be quite helpful. What are the benefits and risks? The benefits are multiple. The main treatment with dermal fillers is really for volume or volume loss. So I think one of the most common complaints I get from patients when they're coming in thinking about doing dermal fillers is the under eye area, also known as the tear trough area. So people feel it's gone really hollow and they want to treat it because they think it'll make them look nice and fresh, which is true in most cases. So most of the treatments we do with dermal fillers are aimed at volumizing. But that's only one of the things we do with dermal fillers. There are so many other reasons that dermal fillers can help the look of the entire face. So I tend to not look at one area in isolation. I like to look at the entire field and think about what might improve it. For different people, they're looking for different things anyway. Someone who's a little bit older and who's lost volume might be looking for that. Someone might be looking just to smooth out their lines. Dermal filler can actually do that as well. Someone might be looking for a more glamorous look, and I find this is some of my younger patients that want the big lips and they want the prominent cheekbones and they want the strong jawlines, and some of this stuff is very fashionable at the moment, so I do get a lot of requests for that as well. And within reason, we do all of these. I'm very realistic about the results I promise my patients, and I'll come back to what I mean when I say that. At the end of the day, dermal fillers are fillers. They're not surgery. So that's one thing you have to keep in mind when you're talking about them. The next question, are they dangerous? Again, anything in excess and anything in the wrong hands can be dangerous. Dermal fillers have been known to cause problems primarily with vascular blockage. So what you really need is an injector with a really good knowledge of anatomy and a really good idea of which depth to inject in as well. Some of the main problems we've seen with dermal fillers is getting into an artery inadvertently. Obviously no one's trying to do it, but accidentally getting into an artery, staying there for too long, or depositing a bolus of that gel into the artery and blocking it. Why is this so problematic? Is because your arteries carry blood that is oxygenated and they take it to your tissue, which needs to be oxygenated to live. If I cut off the oxygenation to your skin, it will die. If it dies, it will re-heal because you will make more skin, but it will end up with scarring. So that's what we're trying to avoid. The most catastrophic thing that can happen with dermal fillers is blindness. I'm sure that everyone has heard of that risk by now, and if you haven't, then please go and look more into it because everyone should know that. There is a risk of blindness if injected in certain areas and in certain blood vessels. We try and avoid these areas as much as possible, but the risk is never zero. So this is one of the most important things to understand. The risk is never zero. So we have to be really, really careful in the volumes we inject, in the techniques we employ, in the depth we're at, and the anatomy. Most importantly, the knowledge of anatomy that your injector has. And their experience as well, of course. So there are certain areas that I won't inject for these reasons. There are a few hundred cases of blindness worldwide. There's only a couple in Australia from what my understanding is. And I think that's because we're heavily regulated here. And I think generally we're a pretty conservative nation anyway when it comes to treatments. We don't tend to overdo them so much. Other risks with the dermal fillers, if you haven't heard of the Tyndall effect, that mostly happens in the tear trough area, which is why I tend to talk so many people either out of doing it or being super conservative and never trying to get that perfect result where they don't really have a tear trough hollowing anymore. I think a tiny bit of a hollowing is important. If the tear trough is injected with dermal filler that's too thick in consistency or too superficially placed, this is an area with extremely thin skin. And then there's other areas in your face as well. There's the most common area for that accidental superficial injection of dermal filler or just an incorrect product choose. And dermal filler, if it's placed too superficially, and if you look at the gel, has a bluish tinge to it. So if it's close to the skin surface, that bluish tinge can be seen. And that's why people end up with a little bit of that bluish tinge under their eyes if they've been injected inappropriately. So again, this is an area that requires a lot of expertise, whereas sometimes novice injectors who've just started injecting start sticking needles into this area. And I think that this is an area that requires a lot of knowledge and a lot of expertise and experience, because this is one of the areas that is most frequently compromised with things like Tyndall, overfilling. This is definitely one of the areas that dissolves the most. And the second one is probably lips. Okay. There's not much else I can think of with dermal fillers. I think overall they're quite safe outside of that. And let's talk about their benefits. So other than volumization, which I've already touched on, the other line treatment, there are some lines that you can't address with anti-wrinkle or muscle relaxant treatments, for the fact that they're in areas where the muscle cannot be treated, and they're not lines that develop due to muscular contraction anyway. They develop due to the aging process, due to compromise of the skin, and due to loss of volume underneath the skin. So they need to be addressed in different ways. You might even think about doing some laser treatments, but I won't be talking about that today. So with the dermal fillers, what I tend to do is go superficially under that line, or inject really tiny bits of filler across the line, which really helps support and lift up the line, so they can be used for just line treatment as well. The third kind of injections we do with the dermal fillers is really superficial, almost intradermal injections with hydrating dermal fillers. So these, the hydrating dermal fillers are, even though it's the same family of fillers really, but they're not cross-linked in the same way, and they're not made in the same way. So they're really thin, and they're actually called skin boosters. It's putting the dermal filler on inside your skin instead of on top of your skin. So when we apply the, sorry, I'm just reading the comments as well. And someone just said very important information, especially risk of blindness and arteries blocking. Thanks for sharing. No worries. And I can talk a little bit more about that as well, about the areas where you want to either be really careful or don't let anyone inject you in those areas. So as I was saying, with skin boosters, you can get dermal fillers, or the dermal filler, that the specific one I'm talking about, you can get it in cosmeceuticals and cosmetic formulations that you put on top of your skin. But the particles in most of these preparations are too large to actually be able to penetrate your skin, which is quite tightly packed with cells to keep it safe. So the best thing to do in regards to that moisturization is to actually put the dermal filler inside the skin instead of on top of it, which helps with boosting your cells as well and get your collagen to grow itself. So in time, we notice that skin improves in people who've been doing dermal fillers for a long time. Okay. Will I need them forever? No, you don't. If anything, I think that we over-inject with dermal fillers, and sometimes we inject them too frequently, and that's not necessary at all. There was a recent study that was done by Dr. Gavin Chan, and using MRI on patients who've had dermal filler in the last 5, 8, or 10 years. And they found that the dermal filler was still present in their skin. So dermal filler doesn't just disappear in 6 to 12 months. It may flatten a little bit, but it doesn't disappear. It tends to stay in your skin for a very long time. So its benefits stay in your skin for a very long time as well. What I say to people when I'm injecting them, especially if they're getting injected for the first time, is you'll build a little bit of a foundation with your first couple of treatments, and then you'll start to build the building on top of that foundation. So of course, doing the foundation doesn't take a lot, but making those levels on top of that foundation does take a little bit more. So you just have to be prepared for how much you need to get that end point or the result that you're happy with. And then over time, instead of overfilling that area, if you just give it some time, the filler can expand a little bit because it's hydrophilic, it's drawing water to itself, so it's expanding anyway. So sometimes you just have to give it time. And keep in mind, it's also making some collagen for you. If I stop using them, will my face sag? No, it won't. I think what actually happens is people almost go backwards in age when they've had dermal fillers. And then if you never do them again, you will maybe age from that point onwards. So for instance, if I've treated a 50-year-old and now she looks about 42, she will never age from that point of being 50. Her face will age a little bit differently, and she'll probably age from the point of being 42. But age we will and age we must, because as Dr. Rich famously says, the only way to stop aging is to die. So if you're alive, you will constantly keep aging. Nothing can stop you from doing that, not even surgery. Your skin will keep making more of itself. It will keep sagging. The structures under the skin will keep disappearing. So aging is a process that is continuous. It can't be stopped by anything. And having dermal fillers doesn't speed up the process. And if you never have them, it won't make you worse. If you never have them again, sorry, it won't make you worse. Do they actually lift? Now, this is a very, very contentious subject. A lot of injectors even don't agree on this, I don't think. I personally don't think dermal fillers can lift you. It's not a facelift. It's not a surgical treatment. It's a soft gel that's being placed at strategic points in your face to give the illusion of lift. So I think more importantly, it's not a lift, it's the illusion of a lift. So if you've put the dermal filler in strategic points, you can shift the light reflex or cheat it from certain parts of the face to other parts of the face that make it look more highlighted in that area. So for instance, putting dermal filler in the highlights or the high points of the cheek make people look a little bit more angular and make them look a little bit thinner almost, and bring the light reflex or the point of concentration more high up on the cheek, which makes it look like it's a little bit lifted, but it's not really a true lift. In the same way, we can inject, like I said, in strategic parts of the face to give that illusion. It's like cheating the light, but it's not a true lift. A true lift comes from a cut and lift, which means it has to be surgical. Okay, next question. Why can't I have them when I'm pregnant or breastfeeding? Please refer to the same reasons as to the reasons why you can't have muscle relaxant injections when you're breastfeeding or pregnant, because we don't want to put children or babies or fetuses at risk. There are no studies that we do on patients who are pregnant or breastfeeding. They've had treatments in that time. Having said that, a lot of my patients will have been pregnant with dermal filler in their faces. So dermal filler doesn't just go away. As I said, it lasts in your face for 5, 6, 10, probably even longer, a long time, quite a few years. And in that time, a lot of people obviously have been pregnant and had children and breastfed them. So at any given point, if people have ever had dermal filler, they've done a lot of things with that filler currently present in their faces. The only thing we advise against is not doing the treatments while you're pregnant or while you're breastfeeding. And not that there are any studies done on pregnant breastfeeding women to know if these products cause any problems with fetuses, because no one wants to do a study like that. But they haven't been really known to cause any problems in women who had them in situ while they were pregnant. The dermal filler that we use is a normal constituent of your skin anyway. So the risks of it causing problems in your body are quite low. And I'll talk about what can potentially happen is in some people, and it's extremely rare to have an allergic reaction, but some people can be allergic to some of the products that have been maybe used in the product to make it up as well. So we can be allergic to different components of it. This is extremely rare though. The other problems that I can see sometimes, and sorry I forgot to mention this in risks before, but this is an important one, is risk of infection. So when you've just been injected with dermal filler, the last thing you should be doing is touching your face or putting makeup on your face, because there are little holes in your skin and there's a small risk of developing an infection. There are bacteria sitting on top of our skin at all times anyway, and if we've introduced these bacteria into the filler by not being not being really great with the sterilization process, or compromising the skin by touching it or putting makeup on it, the filler in itself can actually become infected and form something called a biofilm, which is really hard to treat. And then you might need high potency antibiotics as well as the dissolving agents, and we don't know if any of these things are safe in pregnancy. So to circle back to my point about pregnancy, I personally think patients shouldn't be having these treatments when they're pregnant or breastfeeding, because if there were a problem and you needed to be treated with some of these really strong antibiotics, you're probably not safe doing that while you're pregnant. So moving on to the next question, what are their systemic side effects? So again, with dermal fillers, we haven't really seen any systemic side effects. These are small quantity dermal fillers. They're placed locally in your face. It's very rare to see a systemic side effect. If someone is allergic to one of the components, they might have some systemic side effects, but other than that, most of the side effects or complications or problems tend to stay quite localized, and therefore are usually not that complicated to treat. It's just the important thing, and I think the hardest thing sometimes for injectors, is to actually recognize the problem as it happens and address it right away. Will I look frozen or fake? Absolutely. With dermal fillers, this is where the risk of looking fake, I think, or frozen comes in. If you are injected inappropriately and you are over injected, you can definitely end up looking a little bit strange. And it's the bad results I feel people see walking around, where they think dermal fillers are a bad thing. But the idea behind dermal fillers or muscle relaxant injections or any cosmetic treatments is you should never actually be able to see it. It should be that subtle that you just think a person looks amazing or they look really fresh, but you should never really be able to pick what they've had done. But it's unnatural. So as I mentioned, the product that I use, the temporary dermal filler that I use, is actually one of the normal constituents of your skin anyway. You've got plenty of it inside your skin, so it's actually quite natural. It's not derived from animals. It is made up in a lab, but it's from a chemical point of view, it's actually a natural substance. I'm worried about what people think. So I wrote down a few questions about some philosophical questions about people doing cosmetic injectable treatments, because I do think there's a little bit of a chat around these topics. Some people can be quite negative about them as well, which is really sad to see, especially if they're attacking people on social media. But I think that it's more a lack of understanding and information that drives that sort of behavior, rather than based on true events or true complications someone might have seen. I'm worried about the social stigma. I think there is definitely still a bit of a social stigma attached to injectable treatments, but we've come a very long way. I mean, in the 90s and the early 2000s, people were still treating muscle relaxants as if they were a poison. So people were talking about them quite negatively and in negative connotations, and it was part of popular culture. You could see it in movies and shows, which I still watch now and think, wow, they're talking about it as if it's terrible. And now I think the conversation has changed, and this might be partly due to the celebrities we follow, and partly due to social media, and partly due to awareness as well. We're talking about it so much, which I think is great, because I think it makes the process a lot easier for people who might be thinking about it. Also, I think it makes it more transparent between and bridges that gap between injectors and patients. So I think that we're talking about a lot more, which is reducing that social stigma around cosmetic treatments. But it's so vain. This is something I hear a lot, the question of vanity. And it's one of my least favorite questions, to be honest, because I think vanity is not a terrible thing. First of all, I think if you care about your appearance, that's not a terrible thing. Human beings are designed to judge each other on appearance. That's how we judge if we're in danger or not. So when we see someone, our brain is immediately telling us if it's an ally or if it's something we need to run from. So we judge each other quite quickly based on appearance. So if you see someone who's neat and well presented, you always think of them as a professional. You always think of them as more educated, as someone who cares about their appearance, looks after their health, looks after themselves. So appearance is very, very important. So I think in some, to a certain level, vanity is actually quite important. And when we talk about vanity, I think anything that you do to make your appearance a little bit better could constitute vanity. Wearing nice clothes, wearing makeup, doing your hair, all of it is vanity. So really, at the end of the day, we're saying that these are products that might help someone look and feel a little bit better about themselves. And if that's how they're being delivered, that's great. As long as they're not driving something like dysmorphia, which is a completely separate thing to vanity, then it's okay. And I think it's up to us injectors to make sure that our patients aren't doing treatments for the wrong reasons. And that's why we partly have to be therapists and also very, very honest with our patients. I think that's one of the most important things. Okay, so next question. Sorry, I don't know what's happened there. I'm just gonna try and get back to him. But I just want to age gracefully. I think it's a bit of a myth if people think that people who have cosmetic treatments can't age gracefully. If anything, a lot of the celebrities that you think are aging amazingly and look fantastic are probably people who are doing really great cosmetic work, and they're doing it so subtly that it's not prominent, and because it hasn't changed the way they look, it's only made them look nice, that you think they're aging gracefully. But everyone has to age. Everyone ages. We just age at different rates, that's all. But we will all age. You can still age gracefully with cosmetic treatments as well. And a lot of my patient ages range from people in their 20s to people in their 80s. So I don't think there's an age limit to when you can have cosmetic treatments. And I don't think there's anything wrong with using injectable treatments to age beautifully. So I think that gracefully and beautifully need to go together. My partner told me not to. This is always an interesting one. You'd be surprised how many patients I get who say, but my boyfriend or my husband isn't okay with it. And mostly it comes from women. When by the time men have come to see me, I think they're quite comfortable with having treatments. But I think women worry about how they'll end up looking and how their partner's not being very supportive of their idea about getting into the cosmetic treatments field. And I usually say to them, it's because they don't know much about it, and what they're seeing or what they think they're seeing as results of cosmetic treatments actually results of bad cosmetic treatments. So results of good cosmetic treatments is where you look at someone and you think they look great or they look incredible, but you wouldn't think they looked weird and you wouldn't think they looked overfilled. So that's the point of good injectable treatments. So there is definitely a difference. And like I said before, with good injectable treatments, you shouldn't really be able to see it. It should just look like the person's really fresh. I don't know how to find a good injector. It can be tricky. Your injector is basically someone you have a really close relationship with. It's like your GP. And it can be hard to find someone who you have that connection and that relationship with. And sometimes you do have to see a few people that you might not have that relationship, may not be able to form that trust with, or you might not like their treatments. But the good thing about most of these things is they're reversible. So it's okay. Even if you didn't like what was done before, either it will go away in 3 or 4 months, or it can be dissolved. So it's not a problem as long as you're sticking with the temporary forms of these treatments. And then eventually, hopefully, you'll find someone who you feel more comfortable with. I think the most important thing with your potential or future injector is to look at the way they look. That's really, really important because it defines their aesthetic viewpoint as well. The way they look is the way they see beauty. And if you agree with that aesthetic viewpoint, it looks very much the way you would want to, then that's your injector. So I think that's important. Meeting your injector and having a look at them and deciding if you think that they look nice and what they've done for themselves, because 9 times out of 10, we inject ourselves. But even if they're getting someone else to inject them, obviously we're driving most of those treatments ourselves. So it's important to look at us and then decide, I like their aesthetic and that's the person I want to see. That I think is really, really important, but obviously equally important is their credentials. Is your injector a medical professional? And in Australia, non-medical professionals cannot cannot use injectables and can't inject. It's not legal. So injectors should be medical professionals anyway. But then amongst those medical professionals, what are their credentials? What are their postgraduate qualifications? Personally, I'm a fellow of the RSCGP, which is the Royal Australasian College of General Practice. And I'm also a full member of the CPCA, which is a Cosmetic Physicians College. So it's important to look at things like that. Thirdly, how much experience does your injector have? Have they been working for 1 year, a few months, or longer than that? So I think it's important to see people who do have a little bit of experience because they've seen the bad as well as the good and they know how to avoid the bad. Fourthly, look at the results. The befores and afters are important. Make sure that they're not photoshopping the results. That can sometimes happen as well. A lot of our work is word of mouth. So I find a lot of my patients are people who I've treated and then they've gone and their friends have said, oh, you look fantastic. Who's treating you? And then that's how their friends will then come and see me. So I think that's probably the most important thing for us. Our advertisements are our patients who are walking around looking beautiful. They speak for us. And what should I expect from my first appointment? Well, everyone's different, but I personally don't like to necessarily treat people in the first appointment, especially if they've never had any injectable treatments before. If I've got a patient who's come in and they've had injectable treatments before and they've got a really clear idea of what they need, then I'll inject them at the first meeting after I've discussed with them what I think they should be doing. But if it's a person who's never had any injectable treatments before, usually I'll talk them out of doing that treatment on the same day. I'll get them in for a consult. I'll sit with them for sometimes an hour, and I use that time to assess them, not just physically, but even from a mental health point of view. I like to find out how they feel about themselves, and if they if the problems they've come in with are actually the problems that I can agree with, or is it something that I think they might be focusing on too much. After that, I'll present their options, and I'll also talk to them about what I recommend. And most of the times what will happen is my patient and I will meet in the middle and compromise and agree on a treatment that suits us both. So it addresses their concern as well as looks at the global and more holistic beauty in the face. And then I also sometimes talk about skincare as well. So the first appointment, usually, I personally feel should be about just having a conversation, becoming comfortable with each other and agreeing on the treatment plan. And then the subsequent appointment should be for the actual treatment itself, unless you have a lot of experience with injectables and you're just coming in for a top-up or something slightly different. How often will I need to do them? This is different for muscle relaxant injections and dermal fillers. With muscle relaxant injections, their activity only really works for about 3 to 4 months tops. If you're someone who's got a really high metabolism and you like to exercise every day, for instance, you'll run through both products quite quickly, or more quickly than someone who doesn't. If you have a slow metabolism, you don't exercise every day, you might get 4 months out of them. In some areas, you get a little bit longer. In the masseter treatment, which is done for bruxism or teeth grinding or narrowing of the face, the results last for about 6 to 12 months. For hyperhidrosis or excessive sweating, the results can last for 6 to 12 months again. In the face, because the doses are quite low, because we're just trying to modify what the muscles do, we're not trying to shut down sweat glands and sebaceous glands, etc. This can only really last for 3 to 4 months in most people. With dermal fillers, as I touched on it before, they can last you years and years and years. And some people feel their dermal filler goes a little bit more quickly. That can happen. Everyone's different. There's so many individual factors, but things that people who feel like, or they seem to go a little bit flatter on the dermal filler more quickly, I find the commonality there is there'll always be people who exercise a lot who are quite fit and high metabolism. So even if they don't exercise, they're quite fit. So these are the people that will go through the products quite quickly. But still, having said that, I think what the companies tell you to expect 6 to 9 to 12 months or sometimes up to 24 months with the products, I find you get a little bit longer than that out of them. And what you're doing when you're coming back for a touch-up is you're basically topping it up. You're never really retreating the area again. You really just keep topping it up. Eventually, hopefully most people get to a point where they're quite happy with their appearance and they don't need to keep doing it. And then I find I'll see them every 1 or 2 years, and they'll come in just to have a chat about what if they think they'll need to do anything more, if I advise anything. And usually it's because they really enjoy that feeling of coming in, having that chat with me, that connection, and having something done that makes them feel really pretty. And then they'll leave feeling really good about themselves. So I think that the feeling that you have when you're doing treatments for yourself, which is a similar feeling to going and buying a beautiful dress, is you've done something nice for yourself and you look beautiful and you feel really, really amazing about yourself. I think that's why people can sometimes become addicted as well. So filler addiction, I feel, comes from those really good feelings that you have when you have a treatment. And I think in some ways it's really positive to have those good feelings, but in some ways it's also really important for us as injectors and patients as well to cap themselves and know that there is a point where they have to stop or just wait a few months to a few years to be re-injected again. Personally, I think that's, for me, the most rewarding thing is the way I make my patients feel. And the way I make them feel happy about their appearance, but happy about life in general, and just really, really positive. In a way, it's about taking control of your beauty and your aging process as well, which, especially for women, can make them feel really out of control, especially as they go through menopause, etc. And that accelerates the aging process of women who've given birth and had babies, and they can feel like it's accelerated that process. I think it can be quite powerful to take some of that control back and do something nice for yourself that just makes you feel really, really nice. for me, I think that's what I find most amazing about my job, and that's what makes me feel so passionate about it, and that's the reason I've wanted to be a cosmetic physician, is the way that people feel and the way it makes them feel, and the feedback I get from them. Now, I think there are no questions because I think I've been quite detailed and comprehensive anyway. But if you guys have any questions that you want to ask me, and if there's anything I didn't address, feel free to send me a message and ask me, and I will get back to you via DM, and I will get back to you and let you know. Thank you for watching, and thank you for coming onto the live chat with me. And I'll see you guys with another live chat tomorrow, the details of which I will disclose a little bit later today. Bye, guys.